Hi, everyone. Welcome back to the Slimming Surgeon podcast. I am your host, Dr. Kandace Kichler, and today I have a very special guest. It is my good friend, Daria Gaugler. She is actually the host of the Too Tall to Handle podcast. She is a tennis pro, newly minted tennis pro. She's a model. She loves tennis, anything on the Bravo TV network, and she has an obsession with all things wellness and beauty. So, of course, I wanted to have her on so we can talk about all the things.
Wow, what an intro. Thank you.
Do you like how I called you a model?
Yeah, I know. I don't know about that, but
I mean, you are. So here we are.
Thank you. I'm so happy to be here. Book me.
Okay, so today we have a long list of things that we want to talk about.
Yes.
We're going to do this episode kind of back and forth. So she's going to ask me some things, I'm going to ask her some things, and we're just going to get it done.
Yeah, do a little spiel. I have so many questions for you, especially because you're a surgeon, you're a mom, you've gone through so much, you're so smart and brilliant in like every single aspect of life. So,
don't flatter me.
Flattering. It's easy, but okay. First things first, since you are the slimming surgeon.
Yes.
The topic on everybody's minds lately is Ozempic. I know people are sick of talking about it. I'm kind of sick of talking about it, but honestly, this is the place where I really want to get like the facts straight and learn everything that we, maybe don't get to hear the truth in the media. So please.
So, okay, Ozempic. This has actually been around for a while. Like when I was still doing bariatric and weight loss surgery at the hospital, which has been over 2 years ago, that drug was on the market. It's a GLP-1 agonist, which is like a technical term for a drug that's going to affect the way your pancreas functions and how your body processes insulin. So they found out that the side effect was weight loss and started giving it to other people who were maybe pre-diabetic, aka not so diabetic or on the borderline. And then other people who were not at all diabetic and didn't see a major issue as far as like people who aren't diabetic can still take the drug and see that benefit of the weight loss without having negative consequences on their blood sugar.
Okay.
So it's a drug, it's a pharmaceutical, like, is it safe? Yes. My issue, and I think the issue with a lot of people have is that it's literally being abused. Like we see people who are in their 20s and 30s who want to lose 5 pounds and find a way to get this medication.
Okay, but what's wrong with using it for that extra 5 pounds? With diet culture and everything we've been taught pretty much our entire lives.
Yeah.
We've been begging for a miracle drug forever. So now that it's finally here, like, why are we so adverse to maybe wanting to use that?
And I'm not 100% against it. So your question is good. Why can't we just use this? Well, the thing is, there are other side effects aside from the, weight loss, which is a good side effect. There are things like the increased risk of pancreas tumors or thyroid tumors more specifically. Wow. There's an increased risk of gallstones and needing to have surgery for your gallbladder. So, there are other things that can happen that you want to be mindful of. Like you don't want to take this haphazardly. You don't want to take this without physician supervision. Some places are getting this, basically the same molecule or the same peptide compounded in a pharmacy and just giving the bottle to patients and letting them figure it out. And that is totally wrong. I think that's bad.
That's dangerous for sure.
Yeah, no one's going to monitor them or know if they have a complication or help them. I've literally seen that with someone I knew. She was on it. The doctor's like, yeah, just, whatever, you can have it, just take it and, increase your dose as you feel like it. And she had like debilitating vomiting where she was about to go to the hospital because she was so sick. So like, that's another side effect, nausea, vomiting, stuff like that, which is basically how it helps you to not eat, among other methods. But, my other thing is if you're really young and there are these potential issues, like you just have to be mindful. Like you don't want to cause yourself a problem that you're going to have to deal with for the rest of your life for those 5 pounds when there are other things you can do to lose 5 pounds.
Yeah, like if you're someone who's done everything that you can and you're just trying to get rid of those last 10 stubborn 10, 15 pounds. Would that be something that you would, suggest?
I think it can be. There are other medications too, though, that you can use for those last 5 or 10 pounds. So like, it's definitely a conversation you have to have with your doctor. Like if you've got a family history of thyroid cancer, like probably not a good idea to take this, or if you've had pancreatitis for some weird reason in your history, probably not a good idea to take this. But yeah, it can be a very useful tool. And like I've told family members, like, okay, if you are comparing taking a medication with a list of side effects versus living the next 20 years with 20 extra pounds, obviously taking the medication is probably a better option for you so that you can be 20 years healthier than hanging on to that weight for that long, because that in itself will have long-term impact on your health. So, I'm not pro, I'm not anti, I'm like in the middle.
You're pro, do your research and do what's best for you.
Yeah, I'm purple. I'm not red, I'm not blue, I'm purple.
It's a good in between. I've always been actually team Ozempic from the start, because I can imagine when I'm one day pregnant, have my baby, struggling to lose that baby weight. I think that would be a great option, no?
Again,
of course, with diet, exercise, and eating right.
Right. Oh, and that's the other thing. So we are finding that if people who take this medication and lose weight successfully don't change their habits, when you stop it, because eventually you'll probably stop it, you gain it all back.
You'll gain it all back.
Yeah.
So would the perfect storm be take it and then continue with regular exercise, eating right, and then that would be a way to stave off the weight from coming back?
Yeah,
or is
100%.
it kind of destined to come back regardless?
No, I don't think it's destined to come back. I think, weight is kind of like I look at weight issues and like obesity as a chronic medical problem, just like high blood pressure. Like if you're able to get it under control and come off medication and stay off medication, amazing. But there might be a time in your life when you have to go back on it. Hormone happens, hormone changes happen, life events happen, like you have a death close to you, you retire, like you eat differently. There's different things that happen in our life that'll make us gain or lose weight. So you may have to deal with it again. And maybe you take Ozempic again. Maybe you take phentermine. Maybe you take Qsimi. Like there's a lot of different medications. And by the way, Ozempic is in the same class as like Wegovy, Mounjaro. These are all GLP-1 agonists, and these are the ones that in Saxenda. These are the ones that are like the hot topic right now.
I haven't heard of half of those. Saxenda.
They're all injectable. It's very sexy. Not at all, but yeah. So again, I think that it's definitely a good option if you're doing it with the physician supervision. Like you need to check your labs before you take this. You need to like make sure you're otherwise healthy and there's not something else going on. Like what if you have hypothyroidism, which makes people sluggish and gain weight? Like, and you just fix that, then you wouldn't need the medication. So it's definitely something to have in your toolbox.
Okay, good way to supplement. Well, thank you for setting the record straight, because it's something that's been on everybody's minds. And
and the other thing, we're going to like talk this to death.
I know,
but I have to mention it because it's in the media everywhere. There's Ozempic face and Ozempic butt. So
what's Ozempic butt? Is it like the flat teacher butt?
Yeah. So if you lose too much weight too fast, and the other thing we're seeing is some muscle mass loss with Ozempic.
But is that because they're not working out?
I think it's like because the weight loss is like a total body weight loss. Okay. It's not directed at just the fat cells.
That's something to think about.
It's something to think about. So you then might need to come to me for a Brazilian butt lift or for a surgical butt lift to handle the Ozempic butt afterwards. Yeah. Or fillers for your face, for Ozempic face. But we should go to a different topic.
Okay, cool. Okay. So actually I have a next topic for you on the subject of, these procedures. Is there a procedure that you enjoy doing maybe the most? Like a BBL or a breast lift? Or is there something that like, I don't know, maybe you like it because it gives people the most joy, or you find the best results, or you know what I mean? Like what makes it most fun for you, and what is your favorite procedure to do and why?
Yeah. So I really love liposuction right now because it's like liposculpture. Like it's
You're like an artist.
Yeah, I'm chiseling away the fat that people don't want, and maybe I'm putting it in other areas. That would be the fat transfer, or BBL is fat transfer, where we put it into the butt to make the butt bigger. But really just doing the liposuction, because you and I probably don't have this problem, but a lot of people do have a problem where there's that one stubborn area.
No, I do.
I mean, you never know. You don't look like you do.
It's my bra fat right here.
I have that too. Okay, so we need lipo.
Yeah, no matter what, diet or exercise, it does not make a difference.
Exactly.
And so if I were to get liposuction here,
then it would be gone
and it would never come back.
And it would never come back.
Would it like grow to my eyebrows? Like where would the fat go?
People always ask that. That's such a good question. Okay, so yeah, it would go away forever. It would not come back there. Granted, you don't gain like 100 pounds because if you gain 100 pounds, you're gaining weight everywhere, you know, so just don't do that.
Like the way that you can't target, you know, fat by working out, you could also, it would go evenly distributed everywhere else.
Yes,
okay, gotcha.
Exactly. So when you regain weight or when you gain weight after having a liposuction procedure, the area that was your trouble spot is no longer going to be your trouble spot. Okay. So, you know, that bra fat area, the little lower belly pooch that moms have, you know, maybe your butt or your hips, that's not where you're going to put all the weight. It's just going to globally go everywhere. So that's why I love it as well, because it's so life-changing. Sure. Like you see people with like hips that, you know, they've really hated their whole life and they no longer have hips and they wear these new outfits and it just like totally changes their silhouette.
And you change their lives. I think that's so amazing.
Yeah. So, I mean, everything I do changes lives and it really helps confidence, you know, boosting that. The breast surgeries, especially after having babies and breastfeeding, like that's also life-changing. Sure. But the liposuction, since it's typically like large areas, you really see a dramatic difference after the recovery process.
Okay. And then a mommy makeover, I'm also very curious about as well.
Yeah, this is good. So mommy makeover.
Give it to me. Give me, what do I need after I have my babies?
Everything. No, you're probably going to need nothing, but some people are blessed and they really like don't have that many physical changes after childbirth, but other people, you know, it's a lot. It's a lot. So, it's mostly a mommy makeover is typically 2 procedures, like one on your breast and one on your tummy. And so the breast, it could be, okay, you lost volume, but your nipples are still in a good position. So we can just put an implant in or do a fat transfer to the breast. Other times, you know, gravity really takes a toll after the breastfeeding and we need to do a lift. And then other times people like just like grow breast tissue and then we need to do a reduction. So it's typically one of those 3 options. And that's part A. Part B is where we address the tummy and it's either some liposuction because they are hanging onto some stubborn fat or a tummy tuck, whether that be like the full whammy where we, you know, tighten the muscle, the abs that separate diastasis rectus. You Google it. You're going to find exercises that supposedly fix it. But to be honest, as someone who's operated on the belly, you're not going to ever put those muscles back together after they've stretched that much. So we surgically do that. We sew them back together and then we take away the extra skin. That's a full abdominoplasty or like a classic tummy tuck. Some people, they don't really, you know, carry the baby in their upper abdomen, or maybe they don't have the same amount of skin laxity as other people and they can get away with a mini tummy tuck. But that's less common typically, especially because most people come in to see me have usually had 2 or 3 or 4 kids. So it's like the repeated trauma is like, you're ready for surgery.
Oh my gosh, that scares me. Ooh, I have another thought about that. So you see celebrities, they have a baby and they pop it out and then the next day their abs are completely flat. It's a procedure I heard that when the baby comes out, there's a surgeon in there who immediately sews up the tummy and does a tummy tuck. Is that a thing? Is that safe? Is that?
I think that's not true.
It's probably pretty extreme, if anything.
Yeah, I think that's called surrogacy.
Wouldn't that be the dream?
No, obviously, like there's always exceptions, but I don't think anyone would ever do that because it's not safe. Be safe. It's not safe. Like you've just gone through like crazy hormonal shifts, like doing an elective procedure is like not in the cards. And also like you have so much inflammation and swelling, like your uterus itself doesn't shrink down for several days to weeks after having a baby. So trying to like put the muscles together right away is like not even an option.
Okay. That's, I heard what Emrata did. And I was just curious if that was even true or.
Okay. I need to look at her body. And like Google it.
Literally 2 days after she had her baby, she had a washboard abs.
She probably just either had a surrogate. Okay, don't kill me, Emrata fan.
No, she didn't. She didn't have a surrogate. Unless she was wearing a fake bump, which I don't believe was true.
Beyonce had a fake bump. Okay, don't kill me, Beyonce fans.
No, I believe that one.
Seriously.
I saw it inflate when she sat down.
But no, really thin people who are just naturally thin, like models and things like that, like they're able to lose the weight really quickly.
And they just bounce back.
They bounce back. You know, if you have, if you breastfeed, that's one way to help shrink your uterus a little faster. You know, like different aspects of
never heard of that before. That's crazy. There's so many things that women don't talk about.
Yeah.
And that are pretty important to know, I would think.
It is. So like breastfeeding, which, you know, they're going to encourage you to do that in the hospital. It's just like part of
That's what I plan on doing, you know, thank God.
Yeah.
Or hopefully if all
it works,
things go
exactly.
well. Yeah.
Not everyone can, but if you're able to, when you breastfeed, there's like a hormone that releases, I don't know that it's oxytocin directly, but I think it's related to oxytocin. And when that releases at the time that you're actually lactating and like the baby's latching, it causes your uterus to contract. Like you can literally feel it. It feels like period cramps.
Okay.
And that's your uterus contracting and getting smaller after the baby. So it's really beneficial to some degree to help, you know, shrink that down and to like help your uterus heal, at least during the first couple of weeks after having a baby. And that's what I did. I breastfed for 12 days.
With both children? Because you have 2 sons.
Charlie, I breastfed for 2 weeks and then I pumped for 2 weeks. So he got a month's worth of breast milk, and then Camden 2 weeks, like 12 days. I'm not a good
superhero
nursing mom. Yeah, but some people do this for 2 years. So I'm a loser compared to them.
And that's okay too. I heard someone was breastfed until they were 11 years old. I don't know if that's true or not.
Might be weird. It might not be. I don't know.
Power to you, whatever floats your boat.
Exactly.
Live and let live. Okay. On this topic as well, there's so many things I want to know about motherhood. And I think everyone's experiences are so fascinating. They're all so different.
Yeah.
So you've had 2 kids.
Yeah.
They were within 3 years, right?
4. So Charlie's 4 and Camden's 5 months. So yeah.
So your first baby, Charlie.
Yeah.
I'm sure you had the baby bounce back relatively quickly.
Yes.
From what I could see.
Yeah. I felt like I did.
Okay. And then how did it differ at all from the second? Did you find that it was just as easy? Was it a little more difficult?
I feel like, okay, you feel different in the moment. Like in the moment when I had Charlie during that first year, like, yeah, I felt like I bounced back, but it could have gotten better. And definitely after the first year, I really could see changes in my body where I bounced back and got even better than what I was before having a baby. So that was awesome.
Cool.
And going into my pregnancy with Camden, I was probably like what I would consider the best shape of my life. Like I was
amazing. I know.
Thin, but had muscle, you know, very active, could do long workouts, like had good stamina, all the things. Loved how I looked in a bikini before having him.
Yeah, you looked great.
And now
I can attest.
Thanks. And now I'm 5 months after, and you know, there are days where I'm like, oh yeah, I look really good. But there's days where I'm like, no, I'm still swollen.
We all have those days.
Yeah. So it's hard to gauge in the moment. And like, I think especially you've got to give your body that first year for the hormones to rebalance before you can really like critically look at yourself. Like, I think you need to start doing all the things. Like you need to work out, you need to eat right. You need to like try to get sleep when you can get sleep, which is really hard. But you can't make like dramatic changes during that first year. Like, I just don't think that you can. Like, I think you're moving in that direction, but I think after that first year, like the work you put in shows more. Okay. So I'm still in that process. You know, like I said, some days I feel really good. Other days I'm like too swollen. Like, for example, my pants still don't fit me right. Like,
well, at your birthday, I saw your leather pants and they were looking pretty good.
But those were not the right size. Like, I have a lot of clothes from before that still don't quite fit me. So there's time. It just takes time. Like, I think my hips are still a little widened.
Do they stay wide forever?
No, yes and no. Like, maybe I should do...
Like, the bones actually separate.
They do separate, but they're also supposed to come back together. Like, especially after Charlie, they definitely went back together. This time I'm having a little bit harder, but it's still only 5 months. You know, I'm on my feet a lot. I'm not necessarily like waist training and like, you know, doing some of the same exercises I might have been doing.
Did you wear the waist trainer, the corset trainer?
I'm literally wearing a faja right now. It just reminds me to like keep things
They do shit.
pulled in.
They actually work.
I mean, I don't know. Okay, yes and no. Okay. Yes and no.
That was another thing I never knew about, but okay.
Yeah, no, I'll give you some recs. They're on my Amazon storefront if you want to check it out. I have my favorite fajas. But no, I do believe in putting it on soon after the birth because it does help you feel more together because
like the muscle memory.
Exactly. And right after you just feel like weird. Like you could, if you put your hand on your stomach, I don't recommend doing it. You feel like a gap there where the muscles were separated and they gradually go back together. But I think putting on a waist trainer soon after delivery helps that kind of get back together faster.
Oh my gosh. I didn't mean to make this like a motherhood podcast, but there's a million questions. I could be here all day with you asking you about this stuff.
Okay. Well, let's go to you though, quickly. So you just got engaged, right? Okay. So tell us the little story about how that happened. It
was so sweet. So my boyfriend at the time, Dan, he's very busy with work and out of the blue, he goes, where do you want to go on vacation? Let's go somewhere around Christmas or New Year's. And I was like,
Did you know?
Curious. I kind of did, but
Good.
He did his best he could to keep it a secret. And I was like, let's go to Paris.
Yeah.
I've never been to Paris. And so we went to Paris. We left the day after Christmas and he proposed on New Year's Eve. How romantic. Aww. So cliche, but so beautiful.
So perfect.
We were staying at the Shangri-La Hotel. I don't know if anyone's familiar, but it's this gorgeous hotel. It's a 5-star place in Paris. It looks like Versailles. It's all gold and beautiful.
Yeah.
And the night for New Year's Eve, we were all dressed up to the nines, ready to go out. And he said, hey, why don't we go to the lobby and just have a little champagne and do a toast? It's New Year's Eve. Everybody's doing it.
And I feel like this is exactly how he said it.
Yeah, literally. I was like, okay, let's go to the lobby. And of course, we go to the lobby. No one's there. No one's doing a toast. And one of the adorable concierge, her name is Matilda. Shout out to Matilda. She comes up to us and goes, hey, let's go to the ballroom and have some champagne. And that's kind of when I knew it was coming. So I was like, okay, here we go.
Yeah.
And we walk up the gorgeous staircase and we go to this ballroom. It's so beautiful. There's no one in there. There's nothing in there except for a little table.
Oh my God.
With,
I'm getting chills.
With a bottle of Veuve Clicquot, which is my favorite champagne.
Nice.
2 glasses and then a photographer at the other end. And so he got on his knee and, honestly, it was like a blur. I blacked out. I don't remember what he said. I wish I could remember what he said. And, and then
that's why they have The Bachelor, so they can record these moments.
Oh my God. A friend of mine from Pittsburgh is going to be on The Bachelorette this June. I'm so excited. Well, side note, but, then he got on his knee, he did it. And then luckily with the photographer there, we had this gorgeous engagement photo shoot right after. And it was so much fun. It was like the best night of my life.
The pictures are epic. They're so beautiful.
It was so beautiful.
So
it was great.
Yay. That is so awesome. You guys have to follow her so you can see her pictures.
At Daria Goggles.
Yeah. They're so beautiful. And so you guys are thinking you're going to want to have kids at some point.
Yeah, definitely.
So that's why this mom podcast is so relevant.
Yeah. I have so many questions and it really, to be honest, pisses me off how much women's health is really kind of gatekept. Or they gatekeep things. And even my own mother, I asked her, how was your experience? She says, oh, it was great. It was wonderful. I was glowing the whole time. I'm like, okay, thanks for your honesty, but I actually really want to know these things. Is my vagina going to rip to my butthole? You know what I mean? There's so many things we don't talk about.
Okay, wait. So on that note, I had 2 different deliveries. So Charlie was a vaginal natural delivery.
And that's what you wanted.
That's what I wanted at that time. And then Camden was a C-section scheduled. And I would pick a C-section a million times over.
Oh my gosh, half and half say yes. The C-section's the way to go. And the other half is absolutely not do it, vaginally.
Yeah.
I mean, tell me.
Everybody has a different experience. So I think that's why you have such mixed reviews or answers because so my delivery with Charlie was induced. Okay. And if you, I went to Lamaze class before I had him.
The one on the ball where
where they teach you breath work, where they teach you natural ways to have a baby. If you wanted to do it without pain medication or without an epidural, ways to get through it. So I was like, cool, I need to know the tricks anyways, because I'm going to have a kid. Even if I have an epidural, whatever. And of course, at the time I thought I didn't want to have an epidural. When you get induced, and this is what I learned at Lamaze, your body does not it does not react the same way as someone who goes naturally into labor. So I have a blood clotting disorder. So I had to be induced at 39 weeks. Otherwise, like the risk of something happening with my placenta went up and all these things. So I was like, okay, let's do it. Let's be induced at 39 weeks. My body was absolutely not ready to have a baby. Like he was dropped, but not really. I was not at all dilated. So like they put you in the hospital, they put this medication up your body and hope that your cervix dilates. Didn't work. And then it's like my hips didn't want to like do the things that they're supposed to do. Like it was just really traumatic. But what happens when they give like the Pitocin, which is the pharmaceutical version of the natural oxytocin, which is like the letdown, like, and the one that helps you go into labor, that hormone. When you get it artificially through the medication in your IV, your body doesn't really respond the same way. So when you go to labor naturally, when that happens, your body releases like 1 million times of the endorphins, like of a run, so that labor is tolerable. Versus,
so you're like feeling great, and then the baby just slides out. You don't feel great.
I mean, you have a kid, but you know,
great in comparison.
You're able to do it. You know, you're able to do it without pain medication and things like that. Like, you know, people have done it for hundreds of years that way. But when it's artificially done, or when you're like being induced and your body's not ready, you know, maybe the baby's not ready to come out, then it's much more difficult and much more painful. And it's like you go through all these like processes that just are so weird. And I mean, I'm not a home birth advocate necessarily, because I've seen really bad things happen for people who have tried to do that, but also good stories.
Sure.
But, you know, it's also, I'm not like a pro induction person. If you can avoid it, like if you can go 40 weeks in one day and the baby's still safe, like it's probably better for you to have a natural delivery that way.
Sure, makes sense.
So I had a bad experience. My labor was 24 hours. I tore, not all the way to that other area, but almost. There's like 4 degrees, and I tore to the 3rd degree. So I had to be sewed up. And then,
do you know what causes people to tear versus not, or like the severity of the tear? It's just kind of luck of the draw?
Well, I think like a quick labor can make you more likely to have that happen, which obviously mine wasn't quick. Big babies, and then
was Charlie a big baby?
No, he was tiny. So I'm like, this is a ripoff, literally. But it's, you know, I think there's other factors that an OBGYN would know that I don't, but, you know, I had a pretty bad experience. So when I got pregnant the second time and Camden was breech for a moment, and they were like, oh, you might have to have a C-section. I was like, sign me up today, pick the date, no ifs, ands, or buts. We're not going back and collecting $200. Like, this is it. Let's do the C-section.
So then you got to show up ready to go, makeup done.
Yeah.
Scheduled.
I mean, it's surgery. I've already had surgery before, and I'm a surgeon. So like, to me, that's not quite as scary. Yeah. If you've never had surgery, if you're not a surgeon, you know, like that can be really intimidating. Sure. But to me, I'm like, you know what? This is what they do. Like this guy, my doctor, I'm sure he's done thousands and thousands of C-sections. So like, he's not going to mess it up this time. Knock on wood. And he actually had his partner there too. So apparently a word on the street is a lot of times they usually use 2 doctors for a C-section. So like, you're in good hands. So it's like, you go, like you've got a set time, like they're monitoring the baby the whole time. And like your risk of something happening, I think is pretty low.
Okay.
Obviously, there's other issues with C-sections, and like,
recovery about it.
Recovery can be harder, but I actually had a fine recovery. Like I got up the same day, was walking around. Like I don't feel like I was really limited. Like obviously they say you're supposed to have more physical activity, rest after that versus the vaginal delivery, but I was fine. I mean, I didn't try to Peloton the next week, but you know, you take the time.
You're obsessed with your Peloton, so I'm kind of shocked.
I'm on a streak.
Did you never miss a week? You never missed a week?
I never missed a week, but okay, I had to cheat. I had to, because everyone else does. So I'm like, screw y'all.
You're entitled. If you just had a baby, you're fine.
Yeah, if y'all are going to cheat, I'm going to cheat. But that's not my motto for life, by the way. But I'm on a 124 week streak.
It's incredible.
That's over 2 years.
It's amazing.
Like, I'm not going to give up now. So
I think you're the one keeping Peloton alive at this point. After he killed Mr. Big.
Wait, what?
Peloton went down after Mr. Big died on Sex and the City. Don't you remember that?
No.
You didn't watch on the new the spinoff?
Was it a commercial?
No. The Sex and the City reboot. I think
I know what you're talking about now. Wait, he died on Peloton?
Yeah, so Big, after Carrie and Big.
Horrible.
Yeah, I don't remember what the situation was, but I think they had a little tiff, and he goes to ride his Peloton and he has a heart attack and he dies. And then soon after that, Peloton stock went down.
Oh my God. Yeah. They should sue them for defamation.
They might.
They probably did.
I don't know.
They probably did.
Neither here nor there, but
yeah, no, I love my Peloton. The weeks around pregnancy, I did like meditation or stretching to keep my streak going. So yes, I'm a cheater, whatever. But yeah, I mean, activity is so important to me. Like I think it keeps you mentally stable.
Did it help stave off any maybe postpartum issues that you think you could have had, or?
I think it's different every single pregnancy, like how your body responds to the hormones. And like, it also depends on how much stress is in your life at the time, like how in other aspects of your life, you are happy or unhappy. Like, I don't want to talk too much about postpartum because I feel like it's a really sensitive topic and like, it's so different for everybody. And I think everybody, I mean, this is my opinion, I think everybody has some degree of it. It's just how bad it is or how well you're able to cope with it and your support system.
Sure. And the tools that you already have to, handle stress in any kind of situation, I'm sure, and your genetics and how your mother handled it. And I'm sure that all comes to play.
Yeah. So, it's a big thing, but I think people should definitely seek help because like you hear some crazy stories. And
it's so sad that it wasn't really talked about until 10, 15 years ago.
Right. But
that's why we're here, to get everything out in the open.
Yeah, we're going to give it to you raw.
So this has turned into a birthing podcast. Sorry, guys. That was totally my fault.
I know. Okay.
We went from proposals to
you tear during your delivery. Okay, hold on. Let's go to some other topics then. Okay, wait. I want to talk to you about tennis. Okay. So Daria is a rising tennis star. I don't know if you know this. I am the next
Serena Williams.
She really is. She's really good. She is on the team in Jonathan's Landing. And just like, tell me how you got interested in this.
So to be honest, growing up, I never really had a sport. Everyone played hockey or basketball, and in high school, I just never really felt the draw to any particular sport. And where I grew up in Pittsburgh, tennis really wasn't part of the culture. No one really played it. It just wasn't as big as it is obviously down here. Down here, it's golf or tennis.
Yeah. You have to do one or the other.
You have to. Do you do one or the
other? I used to play tennis.
I know, you should play with me. We'll get you back into it.
I know. Once I get my life more organized, that's literally on my list. I want to start taking lessons because I played in high school. But
great. Okay. Did you play all 4 years?
Yes.
Oh, amazing. Okay, then you probably are eons, above anyone else who's just kind of picking up the racket for the first time.
No, I was number 6 of 6, but it's fine.
You were number 6 still. At least you were
cute.
Yeah. That's all that matters. The outfits are so cute.
Yeah.
So when I moved to Jonathan's Landing, it's a gated community that has, golf and tennis. And I said, you know what, why don't I pick up tennis? Let me just give it a shot. And I took a lesson there with my coach, Matt, and I instantly got hit by the bug and I'm obsessed with it.
Yeah. How many times a week do you play?
I play 5 times a week.
Oh my God.
Sometimes 6, sometimes twice a day. And
that's amazing. Yeah. How do you feel like it does? Like, have you noticed changes in your body or your fitness levels since you started playing?
Absolutely. It's a lot of cardio.
Yeah.
And the women I play with, I love them very much, but a lot of them are on the older side. I'm 31. I think the youngest person above me might be 30 years older than me.
Okay.
So I find that I'm their legs, I'm the wheels, I'm the one moving around the court. So your cardio has to be up.
Yeah.
Pretty, and we're playing in Florida heat today. It was 90 degrees. And
oh my God, it was so steamy.
I was there for almost 2 hours. So it's a lot.
Yeah. That's so good for you though. It's so good for like your pores, just like so sweat it out. Do you feel like your arms look better because of tennis? Cause they look good.
That, and also my trainer, Kezia, has made a huge difference in my life. I see her twice a week, and part of that is why, I feel like my tennis game has actually improved because once you're physically fit, it kind of goes hand in hand.
Right.
But, it just feels good because throughout my life, I never really felt like I found my passion or I found like what I truly love to do. And this is what it is.
And I think tennis is very social.
And it actually, it involves your mind a lot. It's almost like a chess game where you're placing your chess piece, aka the ball, where you want to put it in between. And, it's a lot of strategy. It's a lot of, mental game, honestly, to keep you going and keep your stamina. And you really got to dig deep sometimes. And that has changed me a lot mentally as well to become more, tenacious and more, I guess, dedicated. And I've never really been part of a team sport either. So
I know that's what's good. I loved playing doubles. I
love doubles too. Yeah.
See, I feel like in my new life or in the life I am now, because I think we all grow through life. I think now I'd be good at singles, but like when I was in high school, I was petrified. Okay. Like I was like too scared to go up against one other person. And I loved playing doubles because that team aspect. And then it was like all the eyes weren't on me.
Singles, it's all you. There's no one else to lean on. Like with a team sport, you know, you can kind of maybe fade in the back, or if, you know, you lose, you can blame not anyone but yourself, but it's all you. Doubles is great. And I really like, I like watching doubles. Unfortunately, it's never really on TV. Did you watch the French Open?
I didn't. Nick probably did. My husband, he watches literally every sport. It could be like girls pickleball from, you know, 5th grade. And he'd be like, cool, let's watch it.
Oh, he's going to be such a good sports dad.
I know.
You think he'll be the one coaching all the teams?
Okay, so you would think he'd be really good at that. And I'm sure he probably is, but he does not like to coach. Yeah. Okay. Like Nick, my husband, for you guys listening, he played basketball all through college.
'Cause he's like 10 feet tall.
Yeah. He's 6'4".
Okay.
I call him 6'5", you know, on a good day.
With shoes.
Yeah. And so he, you know, in high school they did really well and they did state or whatever. And then he played in college and he had a good time. And then when he moved back, like, you know, he lived in Alabama for a bit after college, but then he moved back to Palm Beach Gardens, like in Florida. And he worked at a school for a little bit and did some coaching there, but he's like, I hated it. Like, it's just different when you're coaching someone who wants to play versus maybe kids who don't.
And whose moms put them there.
Yeah, whose parents are forcing them to, or maybe they're like not as athletically gifted as some of the others. And so I think he found some frustration in it, even though I think like he probably would be really good at it and be very motivating and like a good coach. But
so he could be the sideline dad screaming at everybody.
Probably. Yeah, I know. And I think I'm going to need to like not go because I would probably be crazy too. Like, you know, I would get upset if my kid gets like tackled wrong or something, you know.
He'll tackle back.
Yeah, hopefully. Yeah. Well, Charlie probably not because he's like a softie. He's the sweetest boy ever.
Oh,
but we'll see.
Yeah, we'll see. We'll see. I think it's so fascinating when you have children, even though I don't have them. But when I do, I think it'll be so wonderful and so fascinating to watch them grow up and to see which aspects they take from you, which aspects or personality traits they take from your husband. And that's going to be so cool.
It's wild. It's pretty wild. It's good. It's good. You guys got to get going. You got to get going and get your...
Oh my God, TikTok. I mean, Dan's an old man. He's 38 years old. We got to get it going.
Okay, but did you stop your birth control?
No. And I know we talked about this previously.
Yeah.
This is a good topic,
thing to talk about. Exactly.
You know, there's so much clashing information out there about birth control.
Yeah.
I've been on the pill for 10 years.
Yeah.
You know, you can Google and say that, or see that, you know, you can stop it immediately and become pregnant immediately.
Right.
Then there's people
and some people that does happen.
But then there's also some people where it doesn't happen. And it's scary to think that I could be doing any sort of damage to my reproductive system by being on these pills.
Yeah.
So I'm still on them.
That's fine. And you do you. You do you.
Yes.
But I think that, you know, if having a baby wouldn't like cause a major problem, like you guys are engaged, you're going to get married, like, you know, you're with the person that you want to be with, and you know that like eventually you do want to have kids. Okay. So what's the big deal if it happens 10 months earlier than you thought it would? You know, like that's mindset.
How I view it too. Cause I think we're the women in this situation, but I think Dan, you know, he was born on his dad's 50th birthday. So he thinks that there's all time in the world. For men, maybe there is, but for women, unfortunately it isn't. Aren't geriatric pregnancies
35 and up?
30. Okay. So that's okay. I thought it was 33. So at least it's 35, but that's still really crazy.
It is.
And to
crazy.
even have that terminology attached to it is kind of messed up, honestly.
I know. It's very like, you feel like a loser. You know?
I do. I mean,
you feel like a cripple, like there's something wrong with you. Because my second one, I was 36. I already saw high risk the first time though, because of the blood clotting thing. So like I was kind of used to multiple appointments and things like that. But no, it is like, it wears on you because you do think about more potential issues the older you get. So, you know, my thing is if you wouldn't have a big problem getting pregnant, just stop the hormones. But, you know, whatever. Everybody should do what they feel is right for their body.
Ooh, actually a question too about birth control. So what I've been doing for the past maybe 5 years is I skip the placebos and I just take the active pills just kind of in a never ending cycle. So I never get my period.
Yeah.
Could that be any way or shape or form maybe negatively affecting my hormones or my fertility or?
You're definitely not the first person to do that.
Yeah.
So
I love it.
Yeah. Well, it's kind of like having an IUD, like, cause you don't really have a period when you have an IUD either. But I don't know the answer to that. I don't want to tell you the wrong thing or tell the listeners like, just keep doing that.
Yeah. No, you're the slimming surgeon. You're not like the slimming gynecologist.
Right.
Okay.
You know what? I know. I'll have one on and we can ask her or him that.
Please do.
Yeah. Should we just keep taking these? Yeah. Who knows? Okay. 444, make a wish. Okay, what else should we go over? I'm trying to think here. Do we want to go to Instagram?
Yeah, I think we got some listener questions, right?
Yeah, we do. Okay, let me pull these up. So, and tell them again, what's your Instagram handle?
So my Instagram is Daria Gaugles, DARIAGOGGLES. And if you're feeling really frisky, I have a food blog or Foodsta account that's Daria Gobbles.
Right.
Get it?
Okay. Sorry, I meant to laugh.
No, it's okay. You don't have to laugh.
No, I follow it. I follow Daria Gobbles. Okay. So another thing that people, that we wanted to talk about was what are some of the crazy, like, skincare things we've done.
Okay, good.
Yeah.
Okay, well, actually, one of my first experiences ever getting Botox or filler was with you.
Yeah.
Wasn't
it Booty and Botox? You came to Booty and Botox?
Yes. Oh, yeah, with Liv Figueroa. Yeah. Shout out to her. She's amazing. Yes. But I don't think that's that crazy. I mean, filler and Botox, I feel like, is everywhere. Everyone and their mothers and their dentists can do Botox at this point.
Right.
So,
right.
But what I'm really loving is microneedling and IPL. I've noticed a huge change in my skin with microneedling in terms of like smoothness, radiance. The IPL has helped with a lot of my sun damage due to tennis, and we're in Florida. It's kind of like a fact of life.
Right.
I heard about this new thing and I did it once. It's a new form of microneedling called PRP.
Yeah.
But it's not with your own blood platelets anymore. It's with, I guess, the plasma from donor women who are like young and very, very healthy. And so it helps you with your recovery time. And it's just like a different way of doing microneedling that gives you, I guess, more of a result. Oh. It's very, very new.
Okay. I don't know how I haven't heard of this donor PRP.
Yeah. It's something, don't quote me on it, but I think that's pretty much like what it is.
We'll look it up. Yeah, for sure. No, I mean, that's a great idea.
Yeah. No, it's STEM. It's called STEM.
Stem cells.
Yes.
Yeah.
It's the stem cells from the women.
Stem cells. And then exosomes are also a big trend to use while microneedling lately.
Okay.
What are some things that you've tried that haven't worked or that you felt or that you did that were like stupid?
Let me tell you, my least favorite procedure I've ever done. Some people love it. It really was horrible for me was the lip flip Botox.
Oh,
I looked like Daffy Duck for 2 weeks. I couldn't eat. The food would fall.
Did I do it for you?
No,
okay.
It wasn't you. And it's no fault to the injector either.
Right.
No, it was not you.
What it is.
But I couldn't eat for 2 weeks. Food would fall out of my mouth. And when I would talk, it would go out like this.
Yeah.
And it was a nightmare. And Botox, you can't, dissolve it or get rid of it. You just got to ride it out.
Exactly.
But other than that, I can't really think of much that I had a problem with, or, I always go to great people and do my research and
right. I know.
Yeah, but that absolutely did not work out for me. It was a nightmare.
Some people love it. Some people hate it. I actually love it. I love a lip flip because for me, like it takes my lips that have a good amount of filler in them. But I actually haven't gotten filler in like 2 years. But if I do a lip flip, I'll kind of get that little oomph where it looks like my lips have been touched up, but I haven't.
Does it last a long time for you?
It lasts a couple months. Like, if I were to look like before and after, maybe realistically it's like a month or so because we move our mouths so much. Like you wear through the product pretty quickly. But I feel like I see that little change in how my lipstick goes on, how my lip liner goes on, and like how I smile for a little bit longer.
If only.
And it's like really small amounts of Botox. So it's like not a big deal either financially or like chemically. But I've done that. I've done tons of filler in my face. Like, I think it's important to talk about this because
let's
people
be honest,
are like,
we're not gatekeeping and saying we look this great due to olive oil. Like
exactly.
J-Lo, so.
Oh my God. So crazy.
Yeah.
But like, if you were to look at a picture of me from like, college or before I started doing any of these things, you would think I'm literally a different person. Like, I'm sure people from my past are like, she's had plastic surgery on her face.
She moved to Florida and looks like a housewife.
I mean, literally I used to be brunette and like have no filler, like all the things.
Great.
Yeah. Yeah, it's great. So I started doing Botox a really long time ago, like just micro doses, like baby Botox.
Okay, or like a preventative
Exactly.
Botox.
Yeah.
So that's a thing that people are kind of on the fence of, like, is it truly, which I believe it is.
100%. 100% it is. If you look, there are twin studies where they compare someone who's done it starting in their like late 20s, early 30s versus their sister, their twin, who didn't. And like the aging process is so dramatic.
Makes
like,
sense.
Oh yeah, it's definitely helpful. And then, I think Botox is really important. I think you should do it as early as you want to. So I started doing that in my 20s, definitely during and after med school. So yeah, that's your 20s. I started doing filler probably after that, late 20s, early 30s. And you always start with your lips. You're like, oh, I want juicy lips, so let's do it. But then it, progresses. And you're like, oh, but now I have a smile line. Let's do my smile lines. And then you realize,
the nasolabial folds?
Yep, exactly.
Okay.
And then cheeks. So actually cheek filler is like my go-to. Like I love cheeks. And if you looked at like my profile before and what it looks like now, it's a game changer. So a lot of people come in wanting, oh, I've got like bags under my eyes. Like, let's fill this. Or, oh, like I've got a really deep line here at their nasolabial fold. And it's like, if you put a little cheek filler in, a lot of times those other things that you think you're seeing just totally go away.
Okay. So are you a proponent for under eye filler?
Not really.
Okay, so you're saying the cheeks kind of help
better.
fill.
Yeah.
Okay.
I mean, if you've got to, obviously it's got to be the right ratios. Like under eye filler is so tricky and can cause such negative things that you have to be super careful. And you have to go to somebody who's really, really, really good at it. Like somebody who specializes in that area of the face, or maybe like somebody that's in an eye practice, I would recommend. Because you know what? A lot of times you really need a blepharoplasty. Like you need the skin removed.
And then that's the permanent solution.
Exactly. And it's like one and done. Like why are you going to try to put a bunch of filler around some fat pads that are sticking out when you just need to take the fat pads away?
Okay.
And it's really like blepharoplasty is not a lot of downtime or very expensive considering or comparative to other surgical procedures. So filler, I've done lots of. I started doing IPL like you.
Love IPL.
Microneedling. One thing I did recently is the BBL, which is similar to IPL.
Why do they call it BBL when there's already a BBL? They should have called it something else.
And apparently they trademarked it. So Cyton is like the brand of the laser company that has the BBL. And it's got like a little trademark or whatever, a copyright sign next to it. So like, I guess they thought they were cool, but.
So then what is BBL?
BBL, broadband light. So it's a light treatment. It is similar. It is a type of IPL, but like you get to target certain depths with your laser. So like we put in certain filters, like, okay, we want to get a brown spot. Let's put in the 560. We want to get a red spot. Let's put in the 760, whatever number it is based off of what you're looking for. And it just gives you a really pretty result.
Okay, so if I was someone who had to choose one, though, maybe like financially, these things,
they're similar price.
They rack up. Yeah. But if you had to choose one between microneedling, IPL, and BBL for your skin, what do you think is the...
I would go to BBL because you can do so many different things. And like I said, you can target it with the BBL. Like typically when you're doing an IPL, it's just one laser, one pass, like one filter. The BBL, we can go like, okay, I've got some capillaries around my nose, so let's focus on those. I've got the brown spots, let's focus on those. So that's why I like it. And we combine it at our office with the Halo, which is like a resurfacing laser. I haven't done it yet because I just don't have the downtime. It's not a lot of downtime, but it's just like, I literally have something booked every day. So I can't like...
What is the downtime?
Look like snake face. It's like 5 to 7 days of like social downtime where you like don't want to take a picture, or you don't want to like, you don't want to have like a major event.
Sure. Okay.
So I'm trying to think. Oh, and I did filler in my nose. That
I've heard the liquid nose job. Yeah.
So I was very hesitant because like it comes with a high complication rate, not a high complication rate, but like if you get a complication, it's a big deal kind of situation. So, and I've done it on patients before and they always love it, but you got to be mindful. You got to be careful who you go to.
What kind of complication would come
like
with
necrosis
like
where your skin just falls off on your face?
Oh my God.
Yeah.
Is that reversible or when you
Not really. I mean, if you catch it right away, of course. And
what's a sign early on that you can tell?
Early on would be like pain out of proportion, or like the area where you got injected turning white, or like one side of your nose turning white or really red, or like 1 or 2 days after the injection, you just feeling like still too much pain, maybe starting to get some blistering of the skin, like where it's just not right. Like it should be
another thing that nobody talks about.
It's true. I know. And there's people online who will like advertise the 10-minute nose job and, set their price. And it's like, yeah, it is the 10-minute nose job. But at the same time, like you need to know that it's not like something you should get off Groupon. Yeah.
Yeah. No, absolutely. The only thing I ever got off Groupon was laser hair removal, and actually it was kind of great.
I know. One time I tried to buy this goes back to my cheapo days, but one time I tried to buy IPL on Groupon and it was fake. Like I got no result.
It was a scam?
It was a scam. I mean, it was some type of light treatment, but it wasn't the right thing. And I was really mad. So yeah.
Jerks.
Yeah.
Let's call them out.
I know. Horrible.
Actually, I have one more question too for you.
Okay.
Do you have any experience with I think they're called PDO threads?
Yes. Okay. So I used to do threads at North Palm Beach Aesthetics. Remember my old office?
I love North Palm Beach Aesthetics.
It's still there. You can go see Lori.
I love Lori.
But we did some threads there, like thread lifts. And I do think they have a place, like especially if you are someone who is never going to do like a surgical facelift or whatever you're doing it for. Like if you're never going to seek that slightly more invasive option, it's something that's there. I mean, basically you're taking a thread, which is a suture, which is the same material we use like when we're sewing up a laceration or a cut. We take that thread, we place it where we want, and it can give a little bit of lift or it can give some collagen stimulation. So, is it going to give you surgical results? No, of course not. It's not surgery, but is it going to give you some benefit? There are before and afters. There are cases I've seen where people do see a little bit of lift, or they see some collagen stimulation where their skin over where the threads are just glows a little bit more. Maybe there's a little tightness.
Would that be like the fox eye lift, like the notorious one that Bella Hadid has, how her eyebrows are like up past her forehead?
I think she's had either...
Or a ponytail lift maybe?
Yeah, I think she's had some threads, but I think she's honestly had surgery. Like I think she's had...
For that kind of result, you would have to have a surgery.
Yeah, as much of a lift she has and for as sustained as it is, like when you do the thread lifting above the brow, our frontalis muscle is just so strong and there's like gravity working against that thread that I haven't seen anyone's last that long.
Okay. And so probably would be more worth it just instead of shelling out the cash all the time for the thread, just to do it once.
Yeah. And you can go through the hairline or you could go right on the brow. Like I've actually done the right on the brow lift before several times and it has a good result. It's just, it depends on how dramatic you want it to be.
And you do that at House Plastic Surgery where you're at? Okay, cool.
Yeah. And you can be done under local, which is the good thing.
That's
like
nice.
There are little things that we do that can be done under local where it's like, okay, if you're going to go, over and over again doing threads or over and over doing lip flips, like sometimes you could just cut the skin away and get the result you want forever. So
yeah, I think that makes sense to me.
Yeah. There's all the tips and tricks, but that's what I'm here for.
I know you got all the tips and tricks. I could talk to you forever. I have so many endless questions for you.
I know. I feel like we almost need to wrap up soon.
Okay, well, let's get some questions then from maybe the people that send in something through Instagram.
I know. I'm going to have you back on like really soon because we're just going to keep doing this because it's really good.
Yeah, time's a flying when you're having fun.
Yeah. Okay. Let's see. Okay. We talked about mommy makeover. We talked about, Okay, a typical peek into what it's like being a surgeon.
Okay, like your day-to-day like activities and start us from maybe like the second you wake up, what your morning routine is.
Yes.
And then until you go to bed and what your night routine is and everything in between.
Okay, so I'm going to give you my ideal day.
We don't know what a boss mom bitch does.
Yeah, my ideal day. So this is a day when let's say the kids like sleep really well. Okay. So I'm going to...
Perfect day.
Yeah, the perfect day. So I'm going to get up somewhere around like 5 or 5:30 and then I would exercise. So I'll either Peloton or do like a quick tonal workout. I have both at my house because we made like a home gym during COVID. And I typically do like 20 or 30 minutes. Like I am not a long worker-outer anymore.
I mean, the fact you do it in the morning at all before work, you are a hero.
No, I have so much more motivation in the morning. Like it's way better. I'm less tired going into it if I do it first thing in the morning.
Sure, than like coming home after work and then having to, sling out a workout.
Exactly. Yeah. And I read this book, The 5 a.m. Club, which I highly recommend to everyone. And
I'm sure Dan's read
it. If he hasn't, he's going to, especially after hearing this. But that kind of also like motivated me. So I'll do like a quick 20, sometimes even 15, depending on how intense it is, 15 to 30-minute workout. And then I like to get my coffee and do a little bit of reading.
How do you take your coffee?
I do coffee with collagen powder with creamer.
Okay.
Yeah. And I sometimes add some inulin powder too, which is like a prebiotic fiber. And that's how I take it. Like, I'm not a black coffee girl.
I wish I could be. I'm not, and I never will be. It is gnarly.
It's disgusting. I do try to do creamers that are like natural. So like it's real cream and real sugar. Like, I'm sorry, a little sugar is not going to kill you.
It's not.
Right.
Absolutely.
It's better than chemicals. I mean, maybe it's chemical, whatever. So I'll do my workout, my coffee, a little bit of reading, like me time and preparation. So it's like a little bit of reading for pleasure, but also preparing for my day. So I like to look at my calendar, look at what I'm doing that day, and just like mentally prepare, like go through maybe steps that I need to recall. If it's not a procedure that I do every single day, like think about, okay, what suture am I going to use? Like, for example, some of the procedures, there's different incisions or different approaches. And so like deciding what's best for that patient. Get the kids ready for school, get myself ready for school. I do my hair and makeup every single day.
You do always look fly when you go to the office.
Like, maybe my hair is not perfect, but I at least have done something to it, because I can't just live like that. So I do my makeup, which I've got down to a science. People are like, oh my God, you must take you an hour to do your makeup. No, it doesn't. It takes me 10 minutes. Like,
That's incredible. Wow.
I've been doing this for years. So many
your practice
years.
makes perfect.
Yeah. So no, it's not that big of a deal.
And you have your fancy Crocs and your amazing scrubs.
Yes. I have my Gucci Crocs and I have my fig scrubs, and I get ready for my day. And, I like to spend a little time with my kids, especially before work, to make sure like they feel like I've given them attention. I'm not just rushing out the door. And then I do my thing. I go to work, operate. Like, right now I operate 2 to 3 days a week, like regularly. And then the other days are consult days and follow-up days or injectable days. So it's a nice mix.
Cool. And I'm sure that it depends on which surgeries you are doing that day, but
exactly.
What's the average surgeries that you have to perform in a day? Usually is it like 5? Are you able to fit in 5, 4, 3?
No, it's usually 2 or 3.
That's still a lot.
It's still a lot, because it depends on what they are. Like some patient, like last week, a girl, I did a breast lift, an implant exchange. I did liposuction and a labiaplasty on her. So 4 different things on one person, and then, or other times I might be doing a lift with laser, like it just really, it varies person to person. So, but we try to do more than one thing at one time. That way it's like, if you're going to go under the knife, you're getting a bang for your buck,
You're a one-stop shop. You might as well.
Come out totally transformed.
Remember when Heidi, what's her, Heidi Pratt or whatever, she did like 30 surgeries in one day. Oh my gosh, that was wild.
Honestly, that is so wild. Well, in Florida, there's a limitation. Like, you can only do anesthesia on one person for 8 hours. So you can't go longer. Sense. So like, if you're going to do 30 procedures in 8 hours, you got to be really fast, like really fast. No, I'm sure they went over the time limit because it's California. They're wild. But also, she might've had multiple people operating on her at the same time. Like, you never know. She had a crazy transformation. Did they just get divorced?
No, they are happily still together.
Oh,
and
are
now
you
they're
sure?
Yes, and they're now selling crystals. They have their own crystal selling company. They have
crystals.
2 children. Yeah, I think it's called like Spencer Pratt Crystal or Crystal Pratt Daddy. That's what it is. Yeah.
Oh my God, wait, because I saw something about you remember the other girl, Kristen Cavallari. They posted something about like chicks before dicks, and it was her with Heidi. So I was like, oh my God, are they getting a divorce? But
that was her probably being like chicks before dicks.
Yeah, right.
I'm Kristen Cavallari.
Yeah, so follow us for more reality TV updates.
That could be a whole other episode as well.
I know. You're probably, but see, I don't watch Bravo.
Because you don't got the time. You're too busy.
I don't. I rarely watch TV. But that's another thing about my day. Like, I don't watch TV.
Amazing.
If I'm driving longer than 10 minutes, I'll turn on a podcast, which is why we're here today, to give you some good
listen to this on your commute to work. Honestly, I love a podcast when I'm cleaning my house, when I'm working out. Like, I rarely listen to music anymore, to be honest. My time is podcast. You actually learn, and I think they're fascinating.
I think so too. Like, I've just find such a benefit to it, like personal development wise. Like, your mind is expanding versus just like mindlessly listening to music. I think music today is often trash. So, Whatever. Okay. We probably need to wrap it up.
Okay.
I know. Unfortunately.
This has already been an hour?
It's been an hour. Wow. So people are going to love this and they're going to come back for more. So let's just, we're going to come back. Daria's going to come back because we love her and it's going to be good. I don't know what we'll talk about next time, but we've got a whole list, so it'll be great. Thank you for coming.
Of course. Thank you for having me. This was totally an honor. And I look up to you a lot. And I think that you're such an inspiration. And being here today was truly my pleasure.
We're going to have you on with Dan too.
Okay, cool.
That's what we're going to do. We're going to
bring your husband. I'll bring my fiance and we'll have a gay old time.
Yes. It'll be good. Okay. So again, thank you everyone for listening. Thank you, Daria, for coming on.
Of course.
Follow her, Daria Gaugler, or Daria Goggles. Follow me, Slimming Surgeon. And then, of course, save this podcast, follow this podcast, rate it, review it.
5 stars.
5 stars only. And we'll see you next time.
Bye. Thank you so much.